Johnson, and talking about.
Hi, everyone. My name is Brian. This is Terri, and we are going to be talking about gender-specific counseling and therapy today. Terri, do you know do you want to introduce the different types of gender-specific counseling and what goes into it?
Well, of course. We're finding out more and more. Of course, we know women and men are different. The way they metabolize, alcohol and substances, whether it be food or whatever, that's a biological difference. But there's also differences in the way they handle things culturally, psychosocially. Gender has more to do with that. The biological part is how we metabolize the substance, different acutely and long-term for men and women. The gender part deals more with psychologically, psychosocial, and cultural differences with men and women.
So let me ask you a question.
Mm-hmm.
So what you're saying to me is that a man will metabolize alcohol and drugs differently than a woman metabolizes alcohol and drugs.
Exactly. And in the way we do that too, and not being able to handle as much, is according to what type of drug and how much.
Okay.
But we do handle it different biologically. But what's most important is the reason for starting a lot of drugs and alcohol is different for men and women. Often women are wanting to change their mood, and men and women have different moods that they want to change. But men starting out are looking more for, it gets them kind of excited. They're more for the high thing. And women, it's usually more emotional. So therefore, your interventions are going to be just a little bit different. Especially when it comes to things like stress. Stress is an integral factor for the risk of addiction.
Okay.
And men and women handle stress differently. Women are going to have more cultural influences too, like certain values. Women deal more with shame issues and guilt issues. Not that men don't. Women have more issues related to sexuality or promiscuous during use than men do. There's a lot of factors that go in, a lot of variables that go into that, but there are a lot of differences. Here at Cipriano and Johnson, we're proud to say that we're one of the only ones that, practice and have a gender-specific program at night. Some of your inpatients are doing that now because science is showing this is better outcomes if you do men and women differently. Of course, you also have that romance factor. The same neurotransmitters in the brain by lust are affected like with a hit. So when we separate the two, the women can focus more on their issues and the men can focus more on their without worrying. It gives them a safe place to be able to share things that they're not going to share in the company of men.
So let me just ask you, so what you're saying is that by providing gender-specific treatments that are specific to men and keeping men with men and women with women, you are essentially creating a safe space for people to be themselves or to grasp onto recovery without feeling like they are competing within a dynamic co-ed sort of central.
It also allows the women to kind of collaborate with each other. A lot of women have trust factors with other women. And so this allows the women to kind of understand each other a little better. But it's a whole different, and I've done both co-ed and gender specific. I do the gender specific here at night, and I find women are much more real. They're not worried about how they might look across the room or anything. They're worried about getting to their core issues. And there are different core issues for why people use men and women. They're different in that too. Like I said, that's going to impact what kind of behavioral interventions or what kind of strategies that we're going to use to deal with that. You're not going to use the same ones for men and women because they're reacting and not only psychologically but physically different than men do. So neuroscience has shown that there's better outcomes when you separate the two. So we've been trying that, and it's been very successful for us.
Has it?
It has been, because the women end up usually going to women's meetings where they're more apt to find a sponsor, and they kind of get into it more when they have other women, because they see more women that share the same things they do.
Right.
We have different roles in society, as mothers, and, we have some of us trying to work, it's funny, we work so hard for women to be able to be in the workforce and have equal opportunity employers. But now we're finding that disease is an equal opportunity destroyer, because there's much more women, in recovery. Back in Bill's time, it was like 10% of the women.
Right.
Or maybe that's 10% that reported it. Not really sure on that. But at the same time, more and more women are having different types of stresses, trying to being the breadwinner, having some of the same stressors men have, but then our body doesn't de-stress the same way. So there's a whole different component to both intervention as well as understanding that there's a sexual biological difference, but there is also a gender difference, and that has to do with the psychosocial cultural differences between men and women.
Sounds excellent.
So, yeah.
Okay, so and you lead.
I do the women's group at night,
Right.
And then Jason does the men's group. Both have really taken off. In fact, we're having our monthly pizza party, and we hope everybody will come tomorrow night. And that's why we wanted to kind of because we're going to be celebrating women in addiction, and then the following month they're going to do the men, kind of in addiction. But we want both men and women so that they understand that we're not just trying to separate them, because we thought hanky-panky's going on. No, there are scientific differences in the way that we handle men and women. Age has a lot to do with it too. So you got other variables in there, but for us, and for some of the inpatients that are doing that now, we've had much better outcomes since we've been doing this. So we feel excited that this is working, and we feel excited here at Cipriano and Johnson that we have added this program, and so far it's been very successful. I will be talking a little bit more about it at the pizza party tomorrow night. So really hope everybody can join us. I think we're going to have a good time, and it'll be very informative, and I think people understand just a little bit more about gender-specific programs and why they're important.
That's great. So for those of you who don't know about our monthly pizza party, there is a pizza party on the third Thursday of the month, and that is at Palms Presbyterian. And if you're looking for how do I get there and what do I do, so we have, if you go to our website, ciprianocounseling.com, and you click on the blog aspect of the website right there on the right hand corner, you will see March 21st pizza party and recovery, third Thursday at Palms Presbyterian Church, and that will be that explains exactly what's going on with
and where it's at.
And where it's at, exactly.
Well, we certainly hope you'll join us, and like I said, this was a little tidbit to get you kind of interested in what the topic would be on. We do have one of our first graduates from the program that we've started, after the pandemic. We really got into the gender specific, and she's going to be speaking and how that the gender specific program impacted her. In fact, it's kind of interesting because her husband was in the men's, and so and they have really gotten along better, understanding, communicating wise, just understanding those differences. I think it's made a big difference.
That's
so I
great.
think you'll enjoy hearing, her story and hearing a little bit more about the gender-specific program.
Beautiful.
Okay?
All right. Well, thank you, everyone. Thank you for watching, and we hope to see you on our next one. Thanks so much.
All right. Bye, everybody.
Bye.
See you tomorrow night.